diagnose a patient, right? They come in with symptoms, and you're trying to determine, is this due to a structural or biochemical problem, or is it due to a mind-body disorder? And here's the interesting thing for your listeners. Almost any physical symptom can be one or the other. So let me give you a couple of examples. You can get a headache because you get bopped in the head, or you can get a headache because you're stressed. You can get diarrhea because you ate some bad food or traveled or got a parasite or whatever. You can also get a diarrhea because you're nervous about an exam the next day or a date that you're going to have. You can get chest pain from a heart attack or from angina, especially if you're an older person. And on the other hand, you get that same chest pain from anxiety, or as you mentioned, costochondritis, which is kind of a TMS equivalent for that. So physical symptoms can be caused by a structural or biochemical or disease process. There was this cardiologist who noticed that the fronts of his chairs in the waiting room were worn out a lot more than the backs of his chair. So what that meant is that people were coming in, they weren't sitting and relaxing, they were like sitting on the edge of their seats, literally, waiting for that appointment. And he called that the type A personality as a result of realizing that a lot of his patients were, the type A were angry, irritable, overreactive. He had certain elements to that personality. And he wrote papers on that, and it's pretty well established in cardiovascular medicine that being a type A can contribute to heart disease over many years. We call the personality for chronic pain type T, and it's more related to being hard on yourself, being a perfectionist, a people pleaser, and that sort of thing. So it's a little different criteria. It's not exactly type A, we call it type T. At its extreme, stress can make you sick. That's true. And there's some very, very rare cases of what's called the broken heart syndrome. It's called Takotsubo's cardiomyopathy. It happens actually more to women than to men. These are very rare conditions, and I think what we want to focus on is the more common conditions, because common things happen commonly, right? There's an old saying in medical school that when you hear hoof steps, when you hear hooves, or you hear an animal, think about a horse, not a zebra.
What the hell, man? What's going on? I'm like banging my head against a wall. I had no idea what was going on at the time. And then a couple of years later, it kind of went away with, and I'm not sure if you have any experience with this, but this is kind of related to mind-body psychological stuff. But I had a very powerful psychedelic therapy session where certain traumas were relieved, and this pain in the right eye just kind of magically disappeared at one point. But later on, when I discovered the TMS community and mind-body issues, I looked back at my life, and that was one example where I was like, oh, wow, okay, that was probably very likely mind-body, and I wish I had known at that time, instead of just getting ramped up with stronger and stronger eye drops or moving away from the screens and just being so stuck, right? So many people, like, I look back at that, I'm like, I wish I had known. I wish somebody had said, wish my doctor had said, hey man, this is not an eye problem, it's not your laptop screen, it's not allergies, this is mind-body.